Hi, what's up, guys? I'm Dr. Gurpreet, general dentist at Toothland Dental, located at 345 Queen Street West in Brampton. I wanted to make this video today regarding cavities in kids. I'm talking about kids who are, as young as 4 or 5. What we've been seeing at our practice here is kids come in for the checkups, and they have not one or two, they have 3 or 4 or 5 cavities at a time. There are techniques that parents can implement to mitigate the risk of kids getting cavities. So let's get right into them. When kids are really young, I'm talking about kids who don't have teeth yet, it's a good way, it's a good habit to get into. What you want to do as parents is that use a super soft cloth, run it under water, and just wipe the gums away. Get rid of that milk sitting on the gums. That way their gums stay clean. And it's also a good way to get into a habit for when the kids get teeth. You're in that habit of constantly cleaning their teeth. That way they're not getting cavities. Once they have teeth, what you want to do is you want to move on to a toothbrush that's appropriate for their age, and you want to move on to a toothpaste. Remember, kids who are really young, they may not follow directions easily, so you want to have a toothpaste that has no fluoride. That's very important. So use a toothpaste that does not have fluoride. That's important. And also Colgate makes the same kind of toothpaste without any fluoride. These are usually for kids who are younger, and I'm talking about younger than 3 or 3. But really, there shouldn't be any age to it. You know your kid better, and if they're able to follow direction, and if after toothbrushing you ask them to spit out the toothpaste, and if they're able to follow it, and they're 3 and older or 4 and older, you probably want to graduate to a toothpaste that has fluoride in it. But remember, ingesting toothpaste that has fluoride is not safe. So now, how often should you be brushing, and who should be brushing? A lot of the times when we ask that question to the parents who bring their kids in, the answer that we get is, the kid brushes, and then they do it on their own, and the kid is only 5 years old. That may not be the right approach. For a kid who's really young, it's best if parents brush for them, and not only brushing, but brushing at the back teeth, brushing all the surfaces of the teeth. So the next question is, when can kids brush their own teeth? Usually there's a milestone. The milestone would be, when they can write their own name. That's a good milestone. When they hit that milestone, that's a good time to kind of let them be independent when it comes to brushing their teeth. But still, supervision is still good. One thing I do want to highlight in this video is that I've been seeing kids who have baby bottle caries or baby bottle decay. What that really means is, kid who's really young, so let's say they're 2 or 3, and then they wake up at nighttime and they need milk. Once we feed them milk, what happens is milk pools are on the front teeth. And that's what we see. We see kids who have cavities at the front teeth. Definitely a way we can prevent that. And that's as easy as just taking this super soft cloth after the kid is done drinking milk at nighttime. Just keep it by your bedside and run it under water, squeeze the water out, and just quickly go from one side to the other. Just wipe the milk away. This will definitely help, and this will definitely decrease kids getting cavities at the front teeth. Those were some quick tips where, as parents, you can utilize to mitigate kids getting cavities. Remember, it's as easy as just wiping the milk away. As easy as brushing their teeth in the morning, brushing their teeth at nighttime. But the most important part is getting into that habit. And even more important thing to do is to brush their teeth, not let them brush it. They're too young. You will definitely cut down the risk of kids getting cavities by a lot. And that's what we want to see when kids come in. You know, they're young, they're scared, they don't know what to expect. And if they have cavities, you know, we have to go in there and do the filling. Sometimes we have to refer them out to a specialist if they have a lot of cavities, or if the cavities are really big in size. And we don't want to do that. I really don't want to do that. I really want to have kids come in, just get the cleaning done, and I want to see no cavities. You know, that way what happens is when they grow up, they don't have that fear of going to a dentist, because they haven't had an experience where invasive procedures had to be done to fix their teeth. And it starts at home. As easy as wiping the milk away, as easy as just brushing 2 times, but brushing it yourself. All right, that's all it takes. Okay, thank you so much for watching. Remember to brush twice a day, once in the morning, once at nighttime. Okay, stay safe, stay smiling. Bye.